It started in 1981, and poignantly enough, in this kind of spot here, 3 young people died back in 1981, and that started off the beginning of the Ballymun Youth Action Project when local people got together to try to come up with a response to the emerging drug situation in this community.
Hi, yeah, my name is Cara. I'm working here in BYAP 19 years. I suppose the first thing I do, the most important thing I do is I'm the first point of contact for people that come to BYAP or ring BYAP. I'd organise for people to come in for assessments. One of the main things I would be saying to people is this service is a confidential service. One of the things I would be very proud of that we do here in BYAP is when we're working with people, people aren't just defined by addiction or what's going on for them around addiction. It's what's going on for them in total. So if there's stuff going on like homelessness, like health related issues, like literacy issues, we do support people in that. Sometimes people just need somewhere to come in and say hello and to have a chat. Sometimes it's coming in and having a cup of coffee, and it's not talking about what's going on for them or you know what's wrong in their life. It's just a human being sitting down with another human being, having a cup of coffee, having a chat. We are a community response, and sometimes that's what our response is, just being part of that community we're in.
So here in the Ballymun Youth Action Project, we like to help people to solve their own issues and come up with their own solutions to their own difficulties. We don't see ourselves as experts in anybody's lives. I guess as workers we see ourselves that we have experience of working with other people in the past, and we have knowledge, I guess, that we've learned from science, research, experience, and we'd like to add that to what the person brings into the room, their own knowledge of themselves, their own experience of themselves, trying to make changes in the past. So we would see the way we work as almost a partnership, a collaborative partnership towards helping people to solve their own problems or make changes that they need to make in their life to have a better life for themselves. So there are a number of different programs that are available if people want to get into that kind of educational development piece. There's the complementary therapies, which involves acupuncture, which is again helpful for dealing with stress, but also helpful for helping stimulate different parts of the body that are at work maybe when people are trying to change, if they're looking at reducing a substance or coming off a substance. There's also different groups or different drop-in settings where people can come in and get together again. The drop-ins are less formal, they're more like almost places of contact or points of contact. Again, for people to check in with staff, maybe other people, see how other people are getting on, but it doesn't really have a formal structure to it. It's more a contact time. And then there are groups as well, if people wanted to link into a group where they can get help from other people in a similar situation, and they can also help people in that similar situation. We work up with a Roost upstairs, which has a lot of different courses available, different FETAC level courses around addiction. So sometimes it's useful for people to do them courses as part of their treatment. If they decide to learn about addiction or learn about drugs, learn about its effects on family, that in itself, that extra knowledge can be a great incentive for people to continue to make the changes that they're making.
We provide the Level 5 Community Addiction Studies course, and we also run a Level 7 diploma in partnership with UCD. And we run a variety of, we've kind of developed and provide a variety of 1 and 2 day workshops that are specific to different aspects of the drug and alcohol work, if you like. Some of those could be the likes of CBT, cognitive behavioural therapy, community reinforcement approach training, working with alcohol misuse, women and substance use, and motivational interviewing. So there's various different types of skill sets that people can add to maybe what they've already got, or if they're beginning to learn about working with people on a one-to-one basis. Typically we have 20 to 25 people who complete the Diploma in Community Drug and Alcohol course each year, and of those this year 9 have gone on to do the level 8 social science degree with UCD, which is really quite significant.
A lot of the time people coming into aftercare are quite stable, so they might be hitting things in their lives that are causing them a lot of distress. So I suppose the kind of work I do would maybe go a little deeper for some people who are ready to do that kind of work. So people maybe suffering with a lot of anxiety, people with issues around relationships, or maybe some childhood traumas, all kinds of experiences that people have had. A lot of the time people come in and just use the space really to look at those issues and deal with those problems that are now facing them, to look at addressing developmental issues, if you like. So also within aftercare, I link in with a lot of the other services within the Ballymun area. So we do a lot of interagency work, huge amount of progression routes into education. That's one of the things I find a lot, that people who become stable or drug-free just are desperate to progress on into training, education. So we have the Ballymun Job Centre, we have the STAR project here. We have a lot of interagency networks within the community that we link in with, that brings people on and makes them progress on to further education. So that's a big part of the aftercare role.
My name is Carl O'Brien. I'm a community addiction counsellor here in the Youth Action Project the last 12 years. My role takes in obviously one-to-one individual work, including key work and care planning, treatment planning, looking at, I suppose, working with people in terms of their process of change. One of my key responsibilities is also the role of working within the drop-in area, which is where we are now today. It's a service that is an open access point for service users to come in. So because I'm based on the ground floor, people can just arrive. They don't need to have a timetabled appointment. They can just walk in. So we're providing brief interventions, crisis interventions for people accessing this part of the building. Key part to the work would also be the role that I have in terms of coordination of the Box and Clever programme, which is a 20-week programme that combines sport, education and rehabilitation. It's run in 3 locations across the community, and it involves 11 stakeholders and practitioners involved in delivery of that. So that starts in September and runs up until mid-March. Roughly around 20 participants involved in each programme as it rolls around. Another key part of the work is obviously the involvement around community collaboration and being involved in a lot of networks and representation of BYAP at them subgroups. So again, they would be looking at prevention, education, treatment, rehab areas of the drug task force. I'd also be involved in the network. So there's an Equal Youth network that looks at training and delivery of training to young people, particularly in Ballymun, that may come from an early school leaving background, and I also be heavily involved in the initiatives that are rolled out because of that. One of the further initiatives of that, again coming from what's happening in responses on the ground, will be the cannabis initiative, which is a subgroup that looks at the impact that cannabis is having on the community, and again trying to develop responses to cannabis use in Ballymun. An additional part of the work is also to support the GP counselling, the GP practice, the primary care unit over in the civic centre. So we work with referrals, and then we support patients in terms of that they will be presenting with having substance use issues.
The prison related services, which is prison work, which is one-to-ones in the prison, and the prison programme. I'm also involved in the drop-in service, which is a low threshold harm reduction service. I also coordinate a day programme service. The activity of the day programme service is to increase individuals' stability through the provision of groups, courses and workshops. Some of the programmes we run within the day programme are reduce the use, relapse prevention programmes, process groups and harm reduction cocaine workshops.
I work as part of the Infant Parent Support Project. So one of the roles that I have there is to work with a craft group. So we started with a Christmas craft group, and it was popular. People enjoyed taking part in it. It allowed people a space to concentrate on themselves in a safe environment. on their own skills. And the really lovely thing about crafts and arts is that there's no wrong way of doing it. So it was about people discovering their own creativity. People also talked about as it being a good social environment where they met new people, made new friends.
And I work here in YAP as an infant parent support coordinator. I link with mums through their pregnancy and until the children are 2 or 3. And for the last 4 or 5 years, I've been studying the theory of infant mental health and how they learn about things. How they learn about themselves is how they're responded to. How they learn to value themselves is how they feel they're valued in that first relationship, usually with a mum or a dad or some primary caregiver. So it's really important that mums are supported to be able to support their babies. So it's about minding the minders. Most of my work is home visits because obviously, you know, the middle of December or in the middle of June even, you've just come home, you have a small baby. It's not that easy to make an appointment here in this building. And because I've been out in the homes, I've seen there's lots of other pressures on mums and dads.
There are a number of other initiatives we run in September to again acknowledge that people are recovering, people are making changes from drug use. We link in with Recovery Walk Ireland. We bring a group into the Recovery Walk, and it's a walk which is a symbol, which symbolises just again the efforts that people are making to change, and it's quite a popular event. We launched our Recovery Quilt, which was again another kind of activity type program we had here for a while, where people create quite a large quilt. And then coming to the end of Recovery Month, we had our annual certificate presentation, where certificates were given out for the various programs that I mentioned. People come up and got certificates who had successfully completed them programs, and also the addiction studies course that we run here in YAP as well, that Arus run.
Well, I think of YAP myself, I think it's a brilliant place for anyone that's in dire straits or has any obstacles in their way. YAP is the place to come, because I wouldn't be where I am today if it wasn't for YAP. I came to YAP and with YAP a good couple of years now, but I wouldn't be standing where I am today, and I can honestly say that I'm standing tall because of YAP, the support I've got from YAP. They actually talk to you as if, like, really treat you as a person, so it's two adults having a conversation. Whether you're in dire straits or not, they're just on your side, the same level as yourself. They don't look at you any differently, where counsellors in the past can kind of look at you differently, like they're higher than you, but YAP, they don't, we're all on the same level. It's very important to the addict, so that no one is higher than them, do you know what I mean? Because that is a big thing. If like, I wouldn't be consistently coming to YAP if I thought that yourself, that you thought you were higher than me. But I learned by coming to YAP that no, everyone is equal, no matter what, like, and that's the way YAP look at you. So I think YAP is the place to be for anyone that's starting off in a very low place. Now I think you should keep going the way you are going, because I've done family thing here with Dame, I think it is, the family things with him, and in the room there, like, none of us could talk at home, like we all scream at each other, me kids and all. I brought 2 of the kids here, and I have to say, our life, the whole family life kind of changed. Do you know what I mean? Instead of us shouting at each other now, we can all have a conversation, talking. So it's not raised voices. So I have to say, I just think, yeah, YAP is the only place in Ballymun for someone to come to if they're really low. This is the place that'll bring them back.
So myself and Katrina have started up an outreach service whereby we go out into the community and we're trying to make links with either people who used to use the service in the past and have dropped off for various reasons, or people who haven't used the service in the past, and to try and get them to make links with the service.
So when we meet people either that were past clients or new clients, we will invite them over for a Tuesday afternoon drop-in, which is 2:30 to 3:30, and this is where they have an opportunity to meet other staff, because there's 5 of us that run that, and they can meet other people, other clients that come here, and we also have sandwiches and tea and coffee. It's also a place where they can ask for support in terms of maybe a one-to-one or brief intervention, you know, if there's some homeless issue, or, you know, the
linking them in with medical services, that kind of thing.
We've done that, linked people over to the men's network as well, so they can get fresh clothes and that. We also have the drop-in centre here, which if there's 1 or 2 of us available, we'll have the door on the right open, and that means people can just pop into us And I suppose the drop-in service and the drop-in afternoon is for people that are low threshold clients. So I suppose one of the initiatives though that the centre has come up with is the crack pipe initiative. So as a response to the use of crack cocaine around the Ballymun area, we wanted to introduce something that was a bit of harm reduction, because there's a lot of issues with how people use crack cocaine.
I'd imagine going forward we will continue to respond and adapt to the needs that come in the door of the project for people that are experiencing some issues or difficulties with drug use or addiction.